In this video, I'll be sharing my advice on the very difficult question of how to pick the right UK medical school for you. Hi, my name is Dr. Joshua Newington. I am an admissions consultant here at the Profs. And I would start by saying, you may know that with many degrees, the university you go to, its prestige, its rank, has an impact on the opportunities and possibilities you have after graduating. And with medicine, it's really very different. Every medical school in the UK is bound to produce safe and qualified doctors of a high quality. And at the time of making this video, the algorithm that allocates medical students to their first doctor jobs is independent of grades. It's independent of the medical school you went to. It's purely a function of your preference. So from that perspective, the medical school you choose will have little to no impact on your work possibilities as a doctor in the NHS after graduating. With that in mind, my biggest piece of advice is to pick a medical school where you will feel safe, happy, and supported. Somewhere that you can see yourself spending 5+ years. It's a long time, and you need to make sure you've got a support network around you and you're in an environment where you'll be able to study at your best. Having said that, there are some more nuanced points you may choose to consider when ranking and applying to medical schools. First of all, it goes without saying that you have to make sure you're picking medical schools that you are a strong candidate for. Different medical schools have different entrance criteria in terms of your A-levels, in terms of the amount of work experience you need, and in terms of the entrance exams they'll ask you to sit. So that should be your first criteria when ranking your schools. And on a more detailed level, you may consider things like dissection. Increasingly, dissection is rare in medical schools as a way to teach anatomy. Dissection is when you use a full cadaver to learn anatomy from. And it's increasingly being replaced by prosection, where anatomy has been prepared for you to witness rather than dissect yourself. If you believe that dissection is a really important way for you to learn anatomy, perhaps if you're very keen on surgery and you want that experience, then that might narrow and focus your choice of medical schools. In addition to that, you may think about the types of hospitals that your medical school is attached to. Perhaps you have a very specialist interest and you want in your medical school career to be exposed to a specialist surgery or procedure which isn't necessarily practiced across the country. You may choose to go to a medical school that has a hospital attached to it that carries out the specialist intervention that you're interested in getting exposure to. In the future, you may choose to work as a doctor overseas, or as many doctors are increasingly doing, supplement your career of seeing patients with allied roles that aren't necessarily within the NHS. And at that point, my previous advice about the rank of your university not mattering suddenly may not be as true. And if you're applying to jobs outside of the NHS, perhaps the reputation of a medical school may become more important. This advice is up to date at the time of recording. Make sure you get the best, most recent advice for your application. Carefully review the criteria laid out on each medical school's website. To get in touch with our team, use the information listed on the screen. Please like and share this video with your friends. And if you have any questions, feel free to drop them in the comments below and we'll get back to you. And as always, best of luck with your studies and your applications.